Yeah. Okay. Yeah. We'll at least will join us in a moment. So we'll go ahead and get started. Thanks. So, hello and good evening, everyone. Welcome. Welcome to our public health update for parents and guardians. My name is Mike Grant. I serve as the director at the Marin County Office of Education. And tonight's update is being recorded. It will be available on the Rethinking Schools website within about the next 24 hours. It is being simultaneously translated into Spanish. And before we get started, I'm going to pass it to my colleague, Michelle Drake, to help welcome our Spanish-speaking members of our community.
Hola, bienvenidos a todos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Claro, gracias a Marta Bitton, que es nuestra intérprete esta noche. Thank you so much.
All right. Thank you, Michelle. And thank you again, Marta, for being here. You're always here with us and for us. So thank you. On behalf of our Marin County Superintendent of Schools, Mary Jane Burke, and our Rethinking Schools team at MCOE, we want to thank you all for being here tonight on a school night for some, right after spring break ended. And I know for some schools in our community, it's during spring break. Tonight you're going to get to hear directly from our public health partners, our public health officer, Dr. Matt Willis, and Deputy Public Health Officer, Dr. Lisa Santora, for the latest update on COVID-19. And this is the most recent in a series of parent and guardian updates that we've been hosting on almost a monthly basis over the course of the school year. And we anticipate this will be the final update of the school year. And unless, of course, something changes and the need arises, we would schedule another one. A little bit of housekeeping. We've received a few questions in advance of tonight's update. And if you have questions that come up during the course of the discussion, the presentation, please use the Q&A tool, and we'll do our best to monitor those questions and address them after the presentation. We can't express in words how incredibly grateful we are to have such a courageous and committed public health partners in Dr. Willis and Dr. Santora, that you've helped us lead the way and stay focused on always doing what's best for students and to doing everything we possibly can to keep our students in school and to find the best ways of keeping students, staff, families in our community as safe as possible with COVID-19 circulating in our environment. So thanks you guys for being here and for your incredible partnership. And with that, I will pass it over to Dr. Willis. Thank you for being here.
Thank you, Mike. I'm just going to provide a little bit of a retrospective view over the past couple of years. This is probably our last convening for this particular school year. This is the end of our second year working together, and I just want to echo Mike's sentiments about how much we appreciate the way the school staff, families, parents, students, Marin County Office of Education, our healthcare partners, really kind of across all sectors throughout the county have come together for this response. And I think one of the strongest elements of our response, looking back at the pandemic as a whole, has really been this partnership between public health and the school community. So I want to spend a little bit of time describing that, because those are strengths that we want to continue to lean into for what remains of this pandemic and then into future challenges we may face. And then Dr. Santora will talk about some of the specifics around our vaccine rollout. And then looking forward, I'll talk a little bit about also the BA.2 variant. Next slide, please. So this is looking back. Next slide, please. Oh, that's a shot from that would have been March 2020 when we were first gathering together. And I remember really this was a distant view of what was happening in China and what we might imagine might be coming into Marin. We were in person, and you all noticed that people were not covering their faces, and that was part of that first phase of this pandemic where we were still learning novel virus, and we've obviously learned a lot since then. Next slide, please. So this was, I think, an important element of our framing and our vision moving forward throughout. This was a slide from, I was looking at some of my slides from March, April, May of 2020. And this was a World Health Organization definition of health: state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that really became an important organizing principle for us because we recognized that every stage we were balancing risks around COVID-19 and then associated other risks of social of distancing, of distance learning, and social, mental, and emotional development if we were to be too restrictive. And that was part of the balance that we were trying to strike along the way. Next slide, please. This is how we were framing this, and I think this is also how these shared values and shared challenges resurfaced and continue to resurface. This is from May 2020. The shared values being health, education, equity, evidence and science, freedom of choice, and dialogue and communication. These are things that we really leaned into as shared values along the way. And then the shared challenges that are still shared challenges, a high level of uncertainty. It's a novel virus. We're afraid of fear of what might happen, of transmission. We recognize we have no zero risk options, and we knew we needed to be adaptable in our response. Next slide, please. So how do we evaluate our pandemic response? It's a challenge, risk on the surface, to evaluate success in something where at best you're mitigating harm. We know that loss and sacrifice were universal and shared, lost lives, lost livelihoods. So we really define success in relative terms only. And by comparing our experience to national, state, and regional experiences allows us to determine where we may have been relatively successful and measurable outcomes in health, economic, education, and social spheres. Next slide, please. So I'm just going to go through some of those very quickly. This is their case rates in Marin County versus case rates in the state of California. About 1 in 5 California residents overall have been infected with COVID-19 since the start of the pandemic. And that number is closer to 1 in 8 for Marin County. So just lower overall burden of infection in Marin due to all of our collective work together. Next slide, please. And then importantly, our hospitalization rates, really trying to organize our strategies around preventing those more severe outcomes, hospitalizations and deaths. Our hospitalizations rates were about 1/3 what they were for the state of California and for the United States as a whole. So that burden of the more severe outcomes in terms of numbers of days people spent in the hospital was also lower for us. Next slide, please. And then finally, deaths. Obviously, the most severe and and the outcome that we are most concerned about in organizing our strategy to prevent. And we had death rates about 1/2 of what they were for the state of California and closer to 1/3 of the rates across the United States. Next slide, please. Importantly, and we've talked about this all the way through the past 2 years, is maintaining a focus on equity and making sure that our more marginalized populations, our more vulnerable residents are well protected at every stage of our pandemic response. And one way we see that we had some success in that domain is that we saw lower case rates compared to other counties among our lowest income residents. And those are in our lowest income quartile. San Francisco and Marin shared the lowest case rates in those communities across the Bay Area. Next slide, please. And here's one of the reasons, right? So we're shifting from some of the metrics of the outcomes to some of the determinants. What did we do right? And this is probably the most important factor. Is that this was data from May of 2021. This was a few months, 5 months after the vaccines were first made available. And at that point, Marin County had the highest vaccination rates of any county with more than 100,000 residents in the United States. Just over a county in Wisconsin. Next slide, please. And then moving to the current state, almost a year later, Marin County still has the highest vaccination rates of any county. Again, these are counties with more than 100,000 residents across the United States, more than 2,000 counties, and just above San Francisco County as being the highest with fully vaccinated and boosted residents. And those previous slides I shared in terms of reduced cases, hospitalizations, and deaths are really directly related to this. Next slide, please. And this was just one of our, I think, earliest signs of how, why we were so excited to be rolling out the vaccine so aggressively in Marin. This is one of our earliest successes was getting the vaccine out to our long-term care facilities, which is the location where our highest numbers of deaths were emerging. And this just shows the case rates in our long-term care facilities, so skilled nursing facilities, residential care facilities for the elderly. First doses in December and January, second doses in January and February. And then just a remarkable drop, a cliff in terms of incidence of disease in those facilities after that second dose really took hold. And that was largely due to the protection the vaccine was offering, and really emboldened us to see the value of vaccinations across the community as a whole. Next slide, please. And then jumping, those are health outcomes, jumping to economic outcomes. If we remember back to that interval of time, almost a year, where we were living under the California blueprint for a safer economy, where case rates and testing rates determined what tier we were in, the purple tier, the yellow tier. Marin County was tied with San Francisco as having, and just above Humboldt as being among the least amount of time. We had, I think, 12 weeks total in the purple most restrictive tier, and the average California resident lived under that purple tier for 21 weeks. So from an economic standpoint, our county was also able to be more open, less restrictive, and that's obviously benefit from a quality of life, but also from an economic standpoint. Next slide, please. Getting to schools. So this is the work that everyone on this call, I think, has partnered in to be, I think, one of our greatest successes as a county. This is the number of student days combined, 2020, 2021, almost 3 million combined student days last year's academic school year. And this was, we're looking back, this was a school year where many schools across the nation did not open. Many schools within our region did not open. We began opening schools in August of 2020. As soon as we were able to, with the waivers, our low case counts enabled that to occur. So spending less time in that most restrictive tier also helped us. And then local policies and practices and all of the cooperation of everyone, in this environment, our school leaders, public health, families, moving together. We're the first county in the state to return schools to in-person instruction, and really we're able to demonstrate that when it's done right, it can be done safely. And that helped accelerate school reopenings, not only regionally, but nationally. Next slide, please. And then again, looking back to that World Health Organization definition of health being social, mental, and physical well-being, we were promoting one of the first counties to actually really suggest that we needed a way for people to gather together socially, safely. And Marin was among that cohort of the first counties in the state of California to promote the social bubble movement in June of 2020 to mitigate the risks of isolation. And these are graphics from back in those days. We were trying to define what a social bubble would be, how many families could be included in a social bubble, whether it could include indoors or outdoors. Lots of decisions needed to be made, but around the value of the need for us to be, as human beings, to be close to one another and being gathering and sharing time together. Next slide, please. So some of the factors that contributed to that success, I think the first is the community itself. It's really, and I feel very grateful, and Dr. Santor and I think, recognize how privileged we are to be practicing public health in a community that looks to science and looks to public health guidance for how we move together. We optimize the tools to prevent spread at every stage, both pre and post-vaccine. We have a shared understanding of our mutual responsibility to one another as a community. And these are positively reinforcing. So the more we did together, we saw that we were able to be more free, less restricted, fewer cases, and those things reinforced themselves. So we moved from strength to strength, is how I think of it as a community. Our policies focus on a balanced response. Evidence, looking at evidence again, the science, and with the focus on equity. And then constant communication. I think this is probably, I don't know how many, we've gone at least 200 forums of some kind or another with with community members, thanks to, I think, the support of you all and the Office of Education. And then strong operations, partnerships across all sectors, really just being efficient in the management of the operations, whether it's the vaccine rollout, whether it's testing, all of this, I think, is not just values, right? It's actually just clean and efficient operations. And that's something that our schools are particularly strong, and the Office of Education. Next slide. So in summary, we've all experienced significant loss over the past 2 years. Loss of lives, loss of livelihoods, loss of days in school. I've got 2 kids who have been in school over the past 2 years, and my older son, missed some important experiences as a junior in high school when it was distance learning. I think we all have, in our own ways, that experience of what we have missed out on. But relative to the nation and the state, we have experienced fewer cases, hospitalizations, and deaths. We have much higher vaccination rates and many more days in school than most would have experienced. And that's due to collective action across all communities and sectors. And we hope that the lessons we've learned in our pandemic response will really carry us through future challenges. Next slide, please. So quickly, before I hand it over to Lisa, what about BA2? So this is the subvariant of the Omicron variant that's been getting a lot of attention, causing increased cases in Europe, now seeing increased cases in New England. And the question on a lot of people's mind is, what is it going to mean for us as a region? I'm reassured that we have not seen any significant surge in our cases in Marin. BA2 has been the dominant variant now in Marin for about a month, and has not led to a surge in cases. And I'm looking very carefully at what's happening in the Northeast. We are seeing increases in cases. That little table there shows increases in New York, Massachusetts, Connecticut. Those are the case rates, 60% increase in New York, 55. So we should maybe be prepared for an increase in cases if that ends up being our experience. But look to that next column, which is hospitalizations. Only 6% increase in hospitalizations in New York, only a 7% increase in hospitalizations in Connecticut, and no increase in Massachusetts. And then actually reductions in death rates. So that's really, again, what we're looking mostly to is that evidence of more severe outcomes. So we should, gird ourselves in some ways for the possibility of more cases, especially as behaviors change with spring break and more travel. So I would not be surprised to see some increase in case rates. But again, we will not be changing our policies until we see more evidence that there's more significant harm in the form of hospitalizations and deaths. And I'm reassured that we are not likely to see that, but we will follow and adapt as we always have. Next slide, please. So in summary, BA2 is the dominant strain in Marin now. We're seeing a slight uptick in cases in our wastewater, but our hospitalizations are stable. And it's really going to be more in the sphere of behaviors. Spring break, facial covering, we're doing less of that. Gathering more is much more likely to be fueling transmission than the variant, the characteristics of the variant itself. Next slide. I think that concludes my bit. Actually, I'll just talk about some of our current, this will take about 2 minutes, our current status. Next slide. And then I'll hand it over to Lisa for the future. So these are our current case rates. It just shows that we've been relatively stable with the BA2 variant now for about 6 weeks in our case rates. Next slide, please. This is our wastewater. We have 4 different sites in Marin County where we measure the amount of virus in sewage. It's actually a really effective way to see the total sort of collective amount of virus in our community. And we saw that Omicron surge in our wastewater, and then it came down, and now it's sort of plateauing at a higher rate than it had been, but not seeing evidence of an increase here. We'll be watching this very closely. Next slide, please. This is that we do sampling of all the variants. It shows that BA2 is increasingly common. Next slide, please. And these are our hospitalizations. And it shows that we are now, I think in Marin, we have 1 person in the ICU, 6 total in the hospital. So these are some of the lower rates that we've seen really since the beginning of the pandemic. And we will expect to see little sawtooth patterns, up and downs in little ways here. It's really larger trends that we're really looking for. And we're not seeing any major upward trend at the current time. Next slide, please. And that concludes my bit, and I'll hand it over to Dr. Santora, who you all know. And I just want to start by thanking Dr. Santora for her amazing vision and leadership throughout this pandemic, especially during a time where I took some time, a few weeks, to be away with family to kind of rebalance after 2 years focusing on the pandemic. I had a wonderful break to be with family, and thanks to Lisa for really making that possible. Thanks, Lisa.
Thanks, Matt. So in looking forward, we're looking backwards a bit. This is an actual photo from Charlinda High School's 2019 graduation, where you can see our students are walking in procession. They're not wearing masks, and that is what we're looking forward to for this spring. As Dr. Willis said, we need to be ready and to adapt to changes, but we are fairly confident that the immunity that we've gained from both vaccination and also natural infection due to that massive surge of Omicron will allow us to have the spring that we were all waiting for in 2020 to return right away, when we thought we'd be out for 2 weeks. And certainly we're hoping to have in 2021 until Delta hit, but we are on course for much more normalized spring and summer celebrations. That being said, it is those human behaviors that are the most predictable with COVID-19 transmission. So the guidance that we have both reflect a relaxation in our policies and also individual level responsibilities that can ensure that we together can end the school year successfully as we prepare for the next school year. You can jump to the next slide. So vaccines, we are a broken record in public health. Vaccines really have proven to be the mainstay of our success, and being an optimally vaccinated and an optimally boosted community, as Dr. Willis showed in his previous slides, just has Marin ahead of the class on every metric where it relates to outcomes. I often compare where my hometown in New Jersey, where we're seeing a lot higher rates of COVID-19, is a very similar community to Marin County in age, and although the price of housing is a lot lower there, that there's a lot of metrics that are very similar across two counties. And just like we see with national data, we really are much further ahead than comparable communities because of those high vaccination rates. And our objective since the beginning has been equitable distribution of vaccines, and that is where we'll be doubling down over this summer and spring into summer, is really to reduce the health disparities that we're seeing in vaccine distribution. And that's looking at booster doses among our Latinx and African-American and Black populations in our community. We're going to be setting an objective to increase those rates significantly by the end of the fiscal year, June 30th. And our ability to achieve that really depends on working in partnership with our schools and our community response teams and community-based organizations. So we'll be focusing on equity in the months to come. Jump to the next slide. And we're also waiting for as many people, and we know there's many school families that have children both in school and regular TK through 12th grade, as well as children in childcare. And we are looking forward to the introduction of the COVID-19 vaccine for the 6 months to 4-year-olds. That is because we have seen that even though it has been a mild disease, with Omicron, we saw severe illness in infants and children between the ages of 0 to 4. And when you compare Omicron to Delta, we saw our youngest children hospitalized at 5 times the rate that we saw during the Delta surge. So it is critically important not only to ensure that our community is boosted, those eligible populations, but our team is also readying to vaccinate or offer vaccine to families with children aged 0 to 4. You can jump to the next slide. And this is where one of our special skill sets is reading tea leaves. And it's hard to do because we're dependent on federal agencies like CDC and FDA. It was in February 11th that Pfizer announced that they were expanding their study to include a 3rd dose. If you look at the dosages, you'll see there's a significant difference between the Moderna and the Pfizer dosage. They are setting a much lower dose. You're always weighing the balance of having a high dose of a vaccine and potentially more side effects. So Pfizer erred on the side of having a lower dose vaccine to avoid less side effects. That's why we didn't see Moderna enter into the United States market for the pediatric vaccine you'll see that even the Moderna announced on March 23rd that they are seeking FDA approval for not only the 6 months to 6-year-olds, but also the 6 to 12-year-olds. You'll see the difference of that Pfizer dose in our 6 to 12-year-olds. It's a 50 microgram dose. It's about half of the adult dose for, well, it's actually half of the adult dose for Moderna. And then the 6 months to 6-year-olds is 25 microgram. The big difference for many families as they consult with their healthcare providers to make decisions and informed choices about vaccinating their children is that the Moderna will be a 2-dose regimen rather than a 3-dose regimen. And then Moderna is also going to be seeking approval for boosters in all of its pediatric populations and seeking FDA approval. And just to note that Moderna is already in the market in Australia, Canada, and the EU. It did not, it was delayed in gaining the FDA approval because of a higher, and even seeking FDA approval because of a higher incidence of myocarditis that was being seen in adolescent males. So that is why it was there was a lag in presenting that to the FDA for approval. But this is what we're expecting. At our best guess, we anticipate that Moderna will hit the market first in potentially May, probably more likely June, and that we're waiting for Pfizer to conclude its studies on that 3rd dose before it submits its FDA approval. So we're really looking at early, and just like we did with our previous pediatric vaccines, we'll be partnering with our childcare providers, community-based organizations, and healthcare providers just to make sure that Marin County residents have access. And our focus again will be on equitable distribution. We have already seen with children 5 to 11-year-olds, even though we have attained significant success, I've mentioned this previously, in high vaccination rates for this group. There are significant disparities among children within our Latinx and African American and Black communities in Marin County. So we'll be focusing at equity from the back.
So Lisa, we're getting a little bit of chop from your signal, but we'll keep going.
All right, Matt will be ready to jump in. It's the winds in eastern San Rafael. It's very windy out there. Actually, it doesn't look like it's windy, but I'll blame it on the winds. So on March 24th, we released our Smarter Plan. This is replacing the 32-point plan. We were hoping to enter this school year with only a 10-point plan. It just took us the full school year to get there. And this aligns with the state's own Smarter Plan. We just made some refinements for the educational community. So again, the broken record of emphasizing shots and staying up to date. It's our most effective tool for preventing COVID transmission in our community. Reinforcing the importance of masks. You're going to be seeing masks play a continued role in our community, especially after exposure events. Staying aware and up to date and being ready to be responsive and to changes in public health recommendations. We want to relax our recommendations as quickly and safely as possible, but we also need to be ready to ratchet up and return to some of the mitigation strategies we had in advance if we do see a surge. And then testing remains an important tool. That's a big changer we had since the winter of 2021 is that we all have access to rapid antigen tests. We just got a note today that testing has been successful. And we had many parents and families report positive antigen tests after engaging in probably some higher risk travel activities or gatherings during the spring break of this past week. So testing remains important, and just encouraging everyone, even on windy days where you blame it on allergies, if it's a new symptom, get tested, assume it's COVID until proven otherwise. And again, just focusing on education and resilience. Like Dr. Willis said, we really look at health with a very holistic definition. It's not just the absence of disease, and focusing on that attainment gap that was already lagging and the inequities that we saw in the attainment gap prior to COVID, and being able to refocus our efforts in reducing that gap, and then ensuring that our children and adolescents have a sense of belonging. We're deeply concerned about increasing substance use disorders and exposure to substances and mental health issues in our student population. So making sure we can focus and use this time both to relax on COVID-19 mitigation strategies, but to refocus and re-energize on jump ahead. So I just want to point out in our Smarter Plan, which will be shared and posted that there was a significant change in our recommendations. The state had strongly recommended that everyone continue to wear masks in schools when they ended their mask mandate and mask requirement in the school setting. When we returned to substantial levels of COVID-19 transmission, we relaxed our recommendations and advised that school staff and students should consider wearing a mask, especially if they or someone in the household is immunocompromised, at high risk for severe illness, or not up to date with their COVID-19 vaccine. So a great example is if grandparents are providing a lot of care for children who are attending school, that would be a family that would want to consider wearing masks, especially as we're in post-spring break time and there is substantial transmission and we're seeing a little uptick in cases. This would be an optimal time for children who have caregiving provided by older adults who are at higher risk for severe disease to continue wearing masks in schools until we return to moderate levels. That's a good example of kind of the nuance in our masking recommendations now. Jump ahead. So this was really big news. It happened on April 6th while many of you were away on spring break. The state updated its guidance around isolation and quarantine, and this is an important step in our pandemic shift from active response to recovery, is the shift towards treating COVID-19 like other infectious diseases in the school environment. And COVID-19, as it was until April 6th, the only infectious disease that required quarantine for exposed persons, unless directed by public health officer, but just as general recommendations. And so that being said, the isolation requirements are still in place. So if you test positive for COVID-19, you still need to stay home for at least 5 days, and then you cannot return to school until you have a negative test on day 5 or later and your symptoms are improving. So that stays in place. But now, regardless of vaccine status, even individuals with higher risk exposure, so household contacts or going on a trip cross country to the East Coast, or engaging and going to a concert where no one's wearing masks, those would be considered high risk exposures, but students and staff are no longer required or even recommended to quarantine. This is a shift in the focus towards education and just focus on being vigilant around recommended mitigation strategies that we're going to talk about in the next slide. You can jump ahead. So if you're an exposed person and you were in a high risk exposure event, if you do have any symptoms, get tested and stay home until you're improving and you prove that it's not COVID. But this is where the layers of mitigation strategies that we presented in the Smarter Plan become really important. So everyone should get tested 5 days after their last exposure or sooner if they develop symptoms. The exception to this is if someone has had a COVID-19 infection within the past 90 days. So it's not just a reflex to testing. You can err on the side of caution. If someone is going to be tested and they have a history of COVID-19, we would, in the past 90 days, we would recommend that rapid antigen testing rather than the molecular testing. So again, we have started to see that reinfection of BA2 on BA1. It's not uncommon, but it's not common. So if it is past 90 days, that's when you return to a regular testing cycle. We're recommending that everyone wear a well-fitting mask indoors around others for at least 10 days. That's the state and CDC guidance. We want to reinforce the importance about the 5 days, and that students and staff who are in that exposed group, they should vigilantly wear that mask for 5 days until they test negative on day 5. We know after 5 days that people will become more lax in their mask wearing behaviors. So if we can have a solid good 5 days after exposure where everyone's consistently wearing that mask until they test negative on day 5 after the exposure, that would be a lot more protective for our community in our school community as a whole than if we had inconsistent mask wearing by many for 10 days. So really focusing on those first 5 days. And again, if anyone develops symptoms at any time, really to get tested right away and stay at home. If you have had symptoms for COVID-19 and you develop symptoms again, get tested. So never doubt a symptom being a COVID-19 symptom, especially with Omicron, we're seeing much less severe symptoms. So just a mild sore throat, a mild runny nose or stuffy nose. So anytime there's a doubt, just get tested. We have sufficient access to testing in our community. So testing is, again, that really critically important strategy. And then masking after an exposure event is the second layer that we have. And then again, just monitoring for symptoms and staying vigilant. And really considering if you had a true high risk exposure where we're seeing attack rates, that's the percent of people exposed range from 20 to 30%, really consider limiting your activities to prevent exposing others to a potential infection. That being said, we're not, public health is not restricting any activities after an exposure because of that balance where the harms of being excluded from those activities outweigh the potential benefits of preventing transmission. So we're not aiming for a zero risk environment. Matt, do you want to add anything here?
I just wanted, there's an opportune moment to sort of illustrate this, which is the 8th grade trip to DC. So, it's a great Marin County tradition that, 8th graders go for their civic education and sense of history to Washington, DC, and a lot of our schools are just, students are coming back. DC happens to be right now a real hot spot for transmission. And we're seeing among 77 kids that came back, I think we have now 22 that were tested positive, and that's just two or three classrooms worth. And we know a lot more of our kids went from schools that we haven't had that kind of systematic testing yet. So we just sent out an advisory to the schools to say any classroom or any group that did participate in that traditional trip, that they should follow what Lisa just went through, which is to see themselves as having had a risk experience, to go ahead and test now or as soon as possible, and to cover their face for 5 days and then test again in 5 days, because we think that there's probably unfortunately some significant risks associated with that particular. And unfortunately, DC happens to be kind of the logical place to go for understanding our civic, but it's also the right now it's the place where you at least want to be in terms of transmission, especially going around museums and that kind of stuff. So we're seeing more cases there.
Great. You can jump ahead to the next slide. So these are just a shift again towards those individual responsibilities and what can we do for ourselves and our families to decrease that risk of transmission. I know we sound like a broken record, but it really is getting vaccinated and staying up to date. We know there's a new guidance around, there's not guidance, I'd say, there's a new opportunity to get a second booster. And we are strongly encouraging anyone over the age of 65 to get that second booster. If you are over the age of 50 and you have a medical condition that places you at higher risk, we recommend you consider that getting a second booster or talking to your healthcare provider. And it also, for even children and adolescents who are 12 and older, who have moderate to severe immunocompromise, should discuss this potential second booster or fourth dose with their healthcare provider. So they've expanded that eligibility of that second booster. So that's a tool we have. Test if you're symptomatic, always assume it's COVID until proven otherwise. I describe my kids as good soldiers. I hand them the swab, they know exactly what to do. That should be what we all are doing when we develop new symptoms. Don't underappreciate the value of wearing a mask, especially if you're planning an event or on going to a more crowded event, or want to use a mask to protect yourself from an exposure if you're planning on traveling yourself. And just those basics that we have, knowing that when you participate in these gatherings or travel, it is an increased exposure risk. And we have also seen a lot of asymptomatic carriage in this Omicron, up to 30% being asymptomatic, especially in a vaccinated boosted population. So that's why it's critically important to test yourself after an exposure or engaging in a high risk activity in that 3 to 5 day time period, just to catch. You might just be the index case, even though you're asymptomatic. Wash your hands, wash your hands, wash your hands. They make physicians do continuing medical education on hand washing because it really is effective. It is probably one of our most effective tools for decreasing the transmission of infectious disease and the most underutilized tool. And so just really encouraging going back to the basics of washing your hands. And so I think that's what we're going to close on, is wash your hands. Jump to the next slide. And a thank you, never always to close on our gratitude. the success that you saw Dr. Willis share in the first series of slides reflects our partnership. We would not have had that success without every single person on this call and the communities and neighborhoods that you represent. And this is a picture not of me or my family, I got it from the web, but it's in our own backyard. And it's where we have so many natural resources in our community, and just really taking advantage of living in Marin, not only for its educational benefits that we have and the great schools that we have, but just the natural wonders that we have, that you can go climbing for 20 minutes and see both the Pacific Ocean and our Great Bay. We're really fortunate to live here. So thanks to all of you for all of your support. I'll close there.
All right. Well, thank you so much, Matt and Lisa, for that kind of look back at where we've been and where we are right now and where we're headed. And I think it's fair to say that through this experience, some of the most vociferous tension has come around, masking and vaccinations, and there's some in our community who are still very concerned. And one specific concern that has come up in a couple questions is around vaccine mandates. And I know, is there any update that you have from the public health side around vaccine mandates for our schools and what the future looks like at this point?
I can, well, it does seem like some of the feedback we get seems to misunderstand that there's a current mandate in place. So we just want to start with that there is no vaccine requirement for children or students in schools currently. There's the possibility that the state of California would require COVID-19 vaccine as a condition for attendance in school in California, public and private, the way other vaccine preventable diseases, you have to have vaccinated against measles, mumps, rubella, et cetera. So there is a list of diseases that are vaccine preventable that children are required to be vaccinated against to attend school. And it is possible that COVID-19 would be added to that list for the next school year. That is not a local determination, that is a state-based determination. And we will be following that as we do others as that comes.
That's great. Thank you for that. And then, so associated with that too, and Lisa, to some extent you covered this, but there's a question that's come forward from a parent about, about multiple boosters for kids, and you covered it, I know, on a slide or two there, but how the science of boosters between adults and kids adds up, and is there evidence to show that kids can be more protected if they get a booster at this point?
This time from our local experience, we saw that boosters were effective in decreasing the risk of transmission in that adolescent population. And so we had our 12 to 18-year-olds who were vaccinated early. This is one of the challenges of being a early adopter community, is that we are often on the first wave of having fully vaccinated populations, but then we're one of the first to have the experience of waning immunity 6 months later. So I think that's again becomes a family decision and informed choice of the risk and benefits of getting a booster. Being up to date today means being boosted, and that's not with the second booster, it's with the first booster. So we really are recommending all eligible populations to stay up to date and get a booster shot. So we'll have a next round of our 5 to 11-year-olds are going to be hitting that time where they become eligible for a booster themselves. And we always recommend people make an informed choice for their families, and especially with children's health, and discussing with their healthcare providers. But we are, just like I mentioned earlier with one of the slides, we're anticipating offering that boosters for all populations, and expecting that up-to-date definition will be for all. And there's something that's there's behind there with the science of vaccines themselves that we have seen with these vaccines, that third dose really increases the neutralizing antibody levels. That's you always want to have in the least amount of vaccine doses. But if you think back to most of the vaccines that are required for school, it's just not a one and done. Everyone wants a one and done, wanted a one and done or a two and done. But the reality is that third dose is has proven to be really important in having that level of neutralizing antibodies. And then I think what we'll be looking at, and this is where a lot is unknown, and maybe Matt can speak to this a little bit. We have the knowns that we navigate based on science and data and evidence about what's effective and what does a population need to have optimized immunity. And then for the example with the second dose, where we really only had limited second booster dose, we only had limited studies. And so it takes time, unfortunately, in a population level, especially when there's different uptakes of vaccine and booster doses, to have definitive what is that optimal vaccine series. And so there's still unknown about what will be the right boost, but if we'll need another booster as a population, not just for vulnerable populations because of an emerging variant. And that's the space where it remains unknown. And that's when we rely on consensus and analyzing the data and evidence to inform our recommendations in public health. Matt, do you want to add to that?
Yeah, I mean, I think you captured it. Exactly. The fourth, there's a big difference between the first and the second booster in our minds. The first booster is kind of obvious from an immunologic standpoint from the studies. It really should have been kind of a 3-dose series to begin with. That's how I think of it. It's like it was 2 doses because there was we needed to get that vaccine out there. It's a year into the pandemic. That's the way the studies were designed. A lot of vaccines that have kind of more time to be developed would be 3-dose series. And it turns out this would have been a 3-dose series. Okay, so you got your first booster. Now you're really fully protected with the first booster or 3 doses. Then along comes a second booster, 4th dose. If you look at the data isn't as clear. We are not promoting that second booster dose in any way, compared to the way we were promoting the first booster. In Marin County, our perspective on that second booster is to consider it if you have higher risk. So if you're older, if you're an older resident, 65 older, it's probably good to get that second booster now, especially with BA2 starting to creep into the environment. Putting it higher on your to-do list. But if you're otherwise healthy, 50-year-old, who's eligible, it's probably not as important to put it high on that to-do list. There was a question that came in the chat in terms of if you were infected recently, it's less important to get that second booster dose if you had that first booster dose. So I think we are, it's not like, there will be a point where there's diminishing returns on vaccinations, right? And we want to make sure that at each stage when vaccines are being recommended or offered, that we're being prudent in sort of looking at the science, looking at the evidence, and making the best decision we can. So that's where full series and first booster is unequivocally, I think, our priority. And the second booster, it's reasonable to wait. That's a reasonable decision. It's also, I think, for people who are at higher risk, we're recommending to actually come in and get that second booster sooner. But this is something that we're fine allowing the data to sort of emerge more completely across the globe to really understand where the value is in additional boosters beyond that first booster.
That's great. So the takeaway that I get from all the messaging is, if I'm, eligible technically for a second booster, I should just, talk to my doctor and know that the science is still evolving on it. And there's some indication it might help, not sure how much, but that's how I'm going to take it. So
yeah, that's right. And if you're really high risk, if you're getting infected, then you should probably go ahead and get it. Right. That's the message.
Okay. So there's a couple, preschool related questions. I think one in particular goes to testing. And so I know from the beginning, public health has, in Marin County has really emphasized symptomatic testing or using testing to shorten quarantine or isolation. But it sounds like there's a preschool that this participant is involved in where they're testing toddlers without symptoms on a regular basis just to keep sure they're safe. Is that something public health would recommend in a preschool setting, like regular surveillance testing for preschool kids?
That is a high level of vigilance. That is called surveillance testing. we have not recommended routine surveillance testing as our strategy in Marin for schools as a whole. We are, I think hopefully it's been clear that our testing strategy has really been more focused on making sure that when people are having symptoms or a known high-risk exposure experience, that the tests are used reliably and consistently in those settings, because that's the highest yield for testing. Routine surveillance testing for asymptomatic children on a regular basis has not really been shown to do a lot to prevent transmission, and can, especially with the performance characteristics of the test in asymptomatic people with the risk of potential false positives. So there are some challenges around that particular strategy. And it's not our formal recommendation. That doesn't mean that we're recommending against it. It just means that it's not what we recommend as a practice. Lisa, do you have anything to add to that?
Okay, so I just have a couple more questions here. Okay, what's that? Okay, so there's a question about it sounds like data stating the number of students in a district that are vaccinated and unvaccinated, and that data versus the need for privacy of students. And so I know countywide there's data that shows the percentage of students 5 to 11-year-olds that are fully vaccinated, but that doesn't. Are there any issues around privacy around that data?
We don't share any. I certainly don't share any personal information around vaccine status. It's all de-identified and aggregated. That's their term. So it's percentages. That's the percent of kids that are vaccinated, percent of kids that are not. There's no way to identify those individuals within the way that we present that data.
Okay. So, and I think you might have touched on this, Lisa, but is there any idea when the 5 to 11-year-olds might be eligible for a booster? Is there a date? Did you say the spring maybe?
I think we'd be expecting it as early as May. That would be the earliest we'd expect to see it.
And this would just be going to their healthcare providers or to, are the vaccination clinics that are currently operating and continue to operate?
It would depend on when the approval is gained, and then we would partner with the school district and our healthcare partners to make sure we have access. I think that's where we see there's some knowns in our community where a lot of parents would be seeking, and this is where I'm one of those parents. Summer vacations are coming, so they're going to be, if it's approved, if a booster is approved before summer travel, we would expect a high demand for boosters in Marin County among that 5 to 11-year-old population. So we would partner to make sure we can offer any pediatric booster dose in as convenient as possible of a way. So that would be our priority. And then knowing that for us, we'd also be working on, we would have to have two separate, operationally, we see them as two separate clinics, the 0 to 4-year-olds and a pediatric clinic, just because of conceive of a large number of 2-year-olds getting vaccinated at the same time. So we're going to make sure it's convenient for parents and accessible for parents in partnership with our healthcare providers. I think the earliest, though, based on that tea leaf reading and reading the FDA and the producers themselves, would be May for boosters, which probably many of our kids was in October and November when they got their primary series. So it would be good timing.
So I think that ends our questions from the chat. So I want to thank you both so much for being here, Dr. Willis and Dr. Santora, and for all the parents who were able to join us tonight. This will be recorded and up. I also, there's going to be another, there's going to be a community public health update on April 13th at 3 p.m., which will largely be a repeat of this presentation unless anything changes, but we want to welcome the whole community to join us for that. And I also want to put in a plug, if you missed the March 29th student-led discussion and call to action on the fentanyl crisis, it was a very powerful presentation by 5 of our high school students about the significant concern in our country and our state, and it's hitting Marin County. they're going to put it in the chat, I think. It's posted. The recording of that presentation and the student presentations is on our Marin County School Wellness Collaborative website. So with that, I want to thank you all again for being here. Dr. Santora, Dr. Willis, we'll see you in a couple days. Thanks again, everyone. Good night.
Thank you. Good night.